Good evening, my dear friends. I extend a very hearty welcome to every one of you for today's session on understanding or interpretation of medical reports on urine and stools. It's a very, very important subject for all therapists because unless you properly understand and interpret as to what is the cause of the variations, we can't prepare a protocol, no? From that point, it is very important. And we are very fortunate that we have the best of faculty to teach that subject because, as we all know, Professor Chanchal Agarwal ji madam, really she is an expert and has got a deep rooted knowledge in anatomy and physiology. She is teaching medical students also along with acupressure teaching. She is also one of the versatile teachers who can handle TCM, Ayurvedic acupressure, and her forte is anatomy and physiology. We are all blessed to have her amidst us for today's session. I'm sure all of you will certainly enjoy the session. It's going to be of immense help to all the participants. So on behalf of every one of you, I extend a hearty welcome to our beloved Professor Chanchal Agarwal ji madam to take charge. Welcome madam, namaste.
Thank you so much, sir. Thank you, Ishan. Thank you, Ravindra sir. And thank you every one of you for being present here and attending this session, because I know for every one of you, this session would be very, very helpful. So warm welcome to every one of you. Let us come to the point. Only 1 hour with each other. So today's topic is stool test and urine test. First, we'll focus on stool test, and if time permits, we'll move on to urine test also. Stool test, is this important for us? Is keep on putting the answers in the chat box. Don't unmute yourself. I request every one of you. Is stool test important to every one of us? Is this important? Yes, it is very, very important. Why it is very important? Because it is a way, a medium, a tool to diagnose certain ailments in the body. Okay, so stool test is like blood test is very important. Similarly, stool test is also very important for us. What does it help us in? How does it help us? See, this is a test stool test is a very important test. Why? Because stool test is a test that will help us in understanding whether the person has any type of digestive issue or not. If the person has any type of digestive issue, then the stool test will help us to understand what is the root cause of the problem. For example, the person may have some problem related to liver, maybe problem related to pancreas, maybe some problem related to stomach. So all these can be understood even LI or SI. So where exactly the problem is? Problem है कहाँ? Exactly. Liver में है, pancreas में है, stomach में है, LI में है और SI में है. Whatever is a part of digestive tract where the problem is can be identified through stool test. Second is, if the person has anemia. What is anemia? Anemia is a blood disorder. Blood कम है शरीर में. तो अगर blood कम है, if the person lacks blood in the body, hemoglobin अगर low है, then what is the cause of this anemia? इसके लिए भी डॉक्टर क्या प्रेस्क्राइब करेगा? The doctor will ask for stool test. What may be the cause of anemia? For example, there may be worms. कीड़े हैं पेट के अंदर में, that is leading to anemia. So if worms are causing anemia, the worms are eating up your food and not letting the proper absorption of the food, then the stool test will show eggs or the pathogens in the stool. So maybe worms, or maybe weak liver, or maybe weak digestion, or maybe weak absorption. पेट में कीड़े हैं, या वीक लीवर है, या वीक डाइजेशन ही कमजोर हो रहा है, या डाइजेस्ट तो हो गया बट एब्जॉर्प्शन ठीक से नहीं हो रहा है, इन एनी ऑफ दीज कंडीशंस अ पर्सन मे सफर फ्रॉम एनीमिया. पता कैसे चलेगा? व्हाट इज द रूट कॉज? थ्रू अगेन स्टूल टेस्ट. स्टूल टेस्ट. तो सबसे पहले तो हमें ये समझ में आना चाहिए ना कि व्हाई आर वी गोइंग फॉर स्टूल टेस्ट, किस कंडीशन में हमें स्टूल टेस्ट कराना है. If the person has any type of liver or pancreas disorder, अगर पेशेंट को किसी तरीके की लीवर या पैनक्रियाज का डिसऑर्डर है, देन ऑल्सो द डॉक्टर विल आस्क फॉर स्टूल टेस्ट. सो लिवर रिलेटेड प्रॉब्लम्स. एग्जाम्पल, ऑब्स्ट्रक्टिव जॉन्डिस. Obstructive jaundice. What is obstructive jaundice? Obstructive jaundice is a type of jaundice where the cause is, देखो सबसे पहले तो समझो jaundice होता क्या है. What is jaundice? So jaundice is a condition where the extra pigments which are produced by breakdown of blood, which is called bilirubin, biliverdin, all these are pigments. If these pigments, usually what happens is in normal condition, these pigments come out of the body in the form of bile. Bile से वो pigment शरीर के बाहर निकल जाते हैं through stool and urine. Okay, कुछ pigments blood में रह जाते हैं, but most of the pigments which are excretory in nature, they come out of the body. But if there is any obstruction in the path of flow of bile, bile को flow करके निकलना है and it has to come to duodenal area. But if there is any obstruction there and the bile is unable to come out into the duodenum, तब क्या होगा? The pigments will go back into the blood. That is called obstructive jaundice. Okay, this will give the symptoms and the problems related to obstructive jaundice. So if the person has liver related problems or pancreas related problems, for example, pancreatitis, that means itis in pancreas. Pancreas में swelling हो गई, infection हो गया, inflammation हो गया, that is pancreatitis. तब क्या होगा? Different enzymes will go haywire. Pancreas के different enzymes गड़बड़ हो जाएंगे. और क्या चीज गड़बड़ हो जाएगी? और गड़बड़ हो जाएगी प्रोटीन का डाइजेशन. Why प्रोटीन का डाइजेशन? Because pancreas helps in secreting pancreatic juice, and this pancreatic juice helps in, it has a very very important role in breakdown of protein in the gut. So pancreas अगर गड़बड़ हो गया, pancreas में pancreatitis हो गया, then it will lead to protein digestion. The protein digestion will get hampered. Okay, so how do we understand whether there is pancreatic problem or liver related problem? By going for again stool test. So stool test will show the components which are coming out of the body. अगर ऐसे components हैं which are related to liver, so it will say that liver is getting troubled. अगर कुछ ऐसे component हैं which are related to pancreas, then it will show the problems of pancreas. Okay. Also in case of constipation. तो constipation का तो direct relation ही हो गया stool से. So if there is constipation, a person suffers from continuous, consistent constipation problem, then the problem may be because of digestive juices which are not secreted properly. If the digestive juices are less in amount, तो क्या होगा? Digestive juices कम हो गए, तो digestion ही कम हो गया. Digestion अगर ठीक से नहीं हुआ, तो whatever food is there in the body, it stays in the body for longer period of time. So that is nothing but constipation. Or maybe there is less mucus in the body. Is mucus important for us? Mucus important? Yes or no? Yes, it is very important. Why? Because it forms a lining of the tube of the body, of the gut of the body. Wherever there is a canal, there is always a mucus in the body. Nasal canal, there is mucus. Throat, there is mucus. Esophagus, है ना? Stomach area, there is mucus. Small intestine, there is layer of mucus. Large intestine, there is layer of mucus. अगर ये mucus नहीं हो तब क्या होगा? The gut would be less slippery. If the gut is less slippery, then what will happen? Whatever is the amount of roughage present in the body, it will not be able to come out of the body. ठीक है? So अगर mucus कम है या अगर mucus बहुत ज्यादा है, in both the conditions, it will show in the stool test. और क्या हो सकता है? और maybe there is inactive intestine. There are so many patients who come to us and they say कि हमें तो बहुत समय से constipation है, maybe 20 years, 25 years. तो पूछते हैं कि कब से शुरू हुआ? So they say कि जब बेबी हुआ था, बच्चा पैदा हुआ था, उसके बाद से constipation होने लग गया. क्यों constipation होने लग गया? Maybe, I'm just giving you one example. There may be several reasons for constipation. Maybe some nerve has got compressed or some nerve that was supplying the LI has become inactive. So it is not always the physical organ. It is also sometimes the neurological reasons behind that organ that leads to problem of that particular organ. So अगर LI for example, पहले example समझिए कि यहाँ पे ये gut है ना, throat area, यहाँ पे food pipe है, esophagus. So food pipe से how the food is going down into the stomach? By some compression and relaxation movements. So when we are taking in the food is moving down step by step by compression, relaxation, compression, relaxation. So how is this movement, this peristaltic move, this movement is called peristaltic movement. How this peristaltic movement is developing into the gut, into the food pipe with the help of nerve impulse. So when the nerve impulse is coming, it is forming that pulsatory movement. Similarly, this pulsatory movement is also there in the large intestine. Okay, so when the roughage is there in the large intestine, then it has to move with the pulsatory movement. एक movement होगा. And if there is less supply of nerve impulse, अगर nerve की supply ही वहाँ पे कम है, nerve impulse ही वहाँ पे कम होगी, तो क्या होगा? The roughage, the feces, the excretory material will not be able to move properly. So that is inactive intestine. So what is causing this inactive intestine? How will we understand? By undergoing stool test. So nerve के लिए directly stool test will not guide you. But if we see that stool is okay, or stool is very hard, or stool has mucus, then it will give us a secondary inference कि okay, ठीक है, बाकी सब चीजें ठीक है. That means we have to check the nerve impulse also. Okay, so this is constipation. Another reason for which one may go for stool test is anorexia. Anorexia means less hunger. भूख ही नहीं लग रही. If there is no hunger, अच्छा बच्चों की बात नहीं कर रहे, because every mother will complain कि हमारे तो मेरे बच्चे को भूख नहीं लग रही, मेरे बच्चे को भूख नहीं लग रही. We are not talking about small children. That is something, that topic is totally different. But in an average person, where if the person complains that I am not hungry, I don't feel hunger only, I eat food only for the sake of eating it, that anorexial condition says that there may be some problem related to the gut. Now we need to understand checking the stool. तब हमें stool को check करना पड़ेगा. What is the problem with the stool? Stool will guide us where exactly the problem is lying. For example, the problem may be related to less hydrochloric acid in the body. Why less hydrochloric acid in the body will lead to anorexial condition? Because hydrochloric acid is the acid secreted by stomach that helps in digestion of food. अच्छा, इस एसिड को हमने बड़ा बदनाम कर लिया. क्यों कर लिया? बिकॉज एसिड का मतलब ही है एसिडिटी, और एसिडिटी का मतलब ही है कि समथिंग इज रॉन्ग. लाइक म्यूकस इज इंपॉर्टेंट फॉर द बॉडी. Similarly, acid is also very important for the body. If there is no acid, there is no digestion of food. Food remains undigested. अब आएंगे इसके अंदर, ये भी बड़ा कमाल का टॉपिक है. तो दिस इज वेरी डिफरेंट फ्रॉम व्हाट वी आर टॉकिंग अबाउट, बिकॉज I was just reading and I was observing why so many people are nowadays complaining about vitamin B12 deficiency. हर थर्ड और फोर्थ पेशेंट जो आता है वो हमेशा कंप्लेन करता है कि मुझे ये सिम्टम्स. एंड व्हेन वी आस्क फॉर ask the patient that you go for vitamin B12 test and they find that it is either on the lower side, 200-250 सिर्फ, या उतना भी नहीं है. So why so many people are suffering from vitamin B12 deficiency suddenly? इसका रीजन पता है क्या है? इसका रीजन है एंटासिड्स, जो कि लोग लेते हैं इस तरीके से जैसे मिठाइयां खा रहे हैं. जब इतनी ज्यादा एंटासिड लेते हैं ना, सो दिस एंटासिड मींस एंटी एसिड. दैट मींस इट विल रिड्यूस द अमाउंट ऑफ एसिड इन द स्टमक. व्हिच एसिड वी आर टॉकिंग अबाउट? इट इज ओनली हाइड्रोक्लोरिक एसिड, बिकॉज दैट इज द एसिड प्रोड्यूस्ड इन द स्टमक. सो अगर हाइड्रोक्लोरिक एसिड in the body goes down, in the stomach goes down, then absorption of vitamin B12 is disturbed. ये बड़ा इंपॉर्टेंट पॉइंट है. अगर बॉडी में हाइड्रोक्लोरिक एसिड का अमाउंट कम है तो विटामिन B12 फ्रॉम द गट विल नॉट बी एब्सॉर्ब्ड इन द बॉडी. तो बॉडी में एसिड होनी चाहिए कि नहीं होनी चाहिए? बिल्कुल होनी चाहिए. ठीक है. लेकिन अगर हाइड्रोक्लोरिक एसिड कम है तो it is not only vitamin B12 but also digestion of food that gets hampered and leads to condition like anorexia. So hydrochloric acid is important. Also, if there is ulceration, अगर अल्सरेशन है, that means अल्सर फॉर्मेशंस हैं, यानी घाव हो गए. अल्सर मीन्स घाव, wound. Now, where is this ulcer? Where is this wound? It may be either in the stomach, may be in the duodenal region, may be ileum, jejunum, कहीं भी हो सकते हैं, may be large intestine. So wherever the ulcers are, it will lead to bleeding of the wound. It may or may not. In some conditions, yes, it leads to bleeding of the wound, and bleeding of the wound leads to loss of blood. Okay, so ulcers अगर हैं तो patient will not feel hungry. Why? Because that layer where the stimulus was coming to make you feel hungry. Hunger का stimulation कैसे आता है? भूख लगती कैसे? There's a stimulation that goes to the brain and says, okay, this, if the bag is empty, so the nerve impulse, it's a feedback mechanism. The mechanism goes to the brain and tells your brain this bag is empty. I need something in it to digest it. How will I digest it? With the help of the acid. So if there is no food, stimulus comes. But if there are ulcers, घाव हो गए, अल्सर्स हो गए स्टमक में या इंटेस्टाइन में, तब क्या होगा? स्टिमुलस होगा? नहीं होगा. Why? Because the nerve endings are disturbed, damaged. So if there is ulceration, that also leads to anorexial condition. If there is indigestion, it also leads to anorexial conditions. Anorexia, indigestion. Indigestion का मतलब क्या हो गया? Indigestion, that means there's no digestion, there's less digestion. That means whatever food the person has taken in, it stays in the gut. What is the meaning of gut? Gut means, gut does not mean only stomach. Gut means this is your mouth, this is your food pipe, this is your stomach, then it is small intestine, And then we have the large intestine that opens in rectum and anus. So whole of it, this whole complete pipe, a canal that starts from mouth region and ends in anal canal. This whole of it is, I'm not marking only stomach, this whole of it is gut. Okay. So indigestion means if the food stays in any part, food stays in any part, anywhere, and it has not come out of the body in proper form, excreta in the proper form, and digested food not absorbed in the proper form, then also it leads to anorexial condition. And in that condition, doctor will advise for stool test. Okay, so what did we say? We saw that if there is digestive issue, doctor will ask for stool test. If there is anemic condition, doctor will ask for stool test. If there is liver or pancreatic disorder, stool test. Constipation, stool test. And anorexia, stool test. Also in some cases, Professor G.C. Agarwal ji says that in some cases where there is some metallic, non-metallic poisoning of some elements are there, in that condition also stool test will help us in understanding what type of poisoning is there. Because if it is a metallic poisoning, for example, metals are very heavy in nature and it comes out of the stool. So stool will guide us, okay, this particular unnecessary element is present in it. So this is the reason for poisoning in the body. So stool test is very important. Okay. So these are some of the reasons for which a person will go for stool test. So today is a topic, आज का topic ही ऐसा है जो dirty topic है ना? But ये dirty topic भी बहुत important है. Why this dirty topic is very important? Because this is a topic that will help us in understanding should we go for it or shouldn't we go for it. इसके लिए हमें ये भी समझना पड़ेगा कि ये जो जिस चीज के लिए हम छी बोल देते हैं, है ना, which is not, it does not look good for us, ना, जैसे बोलते हैं स्वीपर, जैसे बोलते हैं क्रो, ये सारे क्या है? Cleaners of the nature, right? Similarly, this excretory material, which may not sound very good to listen to or may not sound very good to talk about, is very, very important of the body, important part of the body. Because if this particular thing that is thrown out of the body as unnecessary material is not there, then you ask a person who suffers from it. उससे पूछो जिसको इसकी तकलीफ है. So हमें ये समझना पड़ेगा कि where is this stool formed. So I'll show you one. This is for everyone. This is for layman. So you understand where is this stool formed, and then we'll come to it to understand more about stool. So this is very interesting and very important. So I'm sharing my screen with you. So this is the whole of the digestive system. So just see. When I'm rotating it, I hope you're able to see. It's not rotating in your view, right? Is it rotating? It's not rotating.
No, ma'am.
Okay, let me share it once again.
It is rotating, madam.
No, ma'am.
Sir, I'll share it again. I think it is rotating now.
Yes.
Okay.
Yes, madam. Yes, madam.
So this is digestive system. This is the front part. This is a side view. And this is the posterior view. So this is where we are interested into, because when we talk about digestive system, I don't know why is it going away. Okay, doesn't matter. Let me show you the structure where we are interested in. So food from mouth goes in, and some part of it is digested in the mouth. Partially digested food goes into the food pipe. And then it comes to the stomach. This is stomach. From stomach, the slurry, 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 that means semi-solid food, comes to the small intestine. So this is small intestine, SI, small intestine. In the small intestine, whole of it is now digested, because partial digestion took place in the mouth, then partly in the stomach, then partly in the small intestine, and now in small intestine whole of the digestion is complete, and the excretory material now comes to large intestine. So this whole thing is large intestine. This is large intestine. Okay, so this is full of it is large intestine. This is large intestine. So in the large intestine, this is the area where the feces or the excretory material, whether you call it feces or excretory material or stool, is present. So stool moves first upward against gravity, transverse, then comes down. It has to cross the S-shaped colon region, gets collected in the rectum, and there's an impulse that goes to brain and says, now it is time to vacate it. So right time, right situation, the sphincter opens up. So there are two sphincters, external and internal sphincters around the anal canal, that opens up. One is voluntary, one is involuntary. We are not going into the anatomy of the body, but when the sphincters open up, the area becomes bigger, the diameter of the canal becomes bigger, and the body throws out the waste. Body throws out waste out of the body. Okay, so if I remove esophagus, stomach, liver, pancreas, also small intestine. Then you will be able to see the colon, cecum, colon, and rectum, also the anal canal. So now you can see there is ascending colon, transverse colon, descending colon, and rectum. Okay, so this is actually the area where this stool is formed. Okay. Fine. So this is clear. What is the area where stool is formed? Where is it collected? And how it is excreted out of the body. Now let us come to very important part. Which says that what is the constitution of the stool. Why this is important to know what is the constitution of stool. जरूरत क्या है ये समझने की constitution ही क्या है, stool बना किससे. ये इसलिए important है so that when we are passing stool, when we are excreting out the excretory material of the body, we should understand what it should be and what it is. See, we are talking about stool test, but our theory of acupressure, the practical knowledge of acupressure says that Khemka sir and Sir J.P. Agarwal ji has already said in his books कि कोई जरूरी नहीं है कि we depend on the lab tests. So you will be able to understand only by looking at your stool whether it is correctly formed or not. So we have to understand what is the constitution. So when we talk about constitution or the composition, it says that it has two parts. One is water and another one is solid part. So water is almost 60 to 70%, and the solid has some organic, some inorganic substances. Organic means protein. Some amount of protein will come out, some carbohydrate will come out, some fat will also come out. It is natural. And when we talk about inorganic, some substances like sodium, potassium, etc. will also come out of the body. So along with protein, fat, carbohydrate, some bacteria, etc. may be there. Why? Because that is also organic, that is also living component. Okay, ये होना चाहिए. ये stool है. So stool में water होना चाहिए क्या? Yes. 60% or 70% of it is water. Stool में solid substances होने चाहिए. Yes, solid stool is a solid substance. So what type of solid substances are there? Some are organic, some are inorganic. But इसमें एक चीज बड़ी important है, बहुत important है, that we should all know is five characteristic features of stool. 5 ऐसी बातें जो हम सबको पता होनी चाहिए स्टूल के बारे में. कौन सी बात पता होनी चाहिए? फर्स्ट इज क्वांटिटी. देखो ये क्वेश्चन तो मैं नहीं पूछ सकती हूँ कि कितने लोग खाना खाते हैं. मैं ये भी नहीं पूछ सकती हूँ कितने लोग पानी पीते हैं, कितने लोग सांस लेते हैं, एंड कितने लोग स्टूल पास करते हैं. बिकॉज जो जिंदा है वो हर पर्सन स्टूल पास करेगा. क्यों करेगा? बिकॉज दैट इज समथिंग विच इज अनवांटेड बाय द बॉडी एंड इज द लास्ट प्रोडक्ट फॉर्म्ड आफ्टर डाइजेशन ऑफ फूड. जब डाइजेशन की बात करते हैं ना, जब पूरे खाने की बात करते हैं, फूड की बात करते हैं, तो फूड के स्टेप से 5 है. कौन कौन से 5 स्टेप है? इंजेशन, डाइजेशन, एब्जॉर्प्शन, एसिमिलेशन एंड एक्सक्रीशन. ये 5 स्टेप है. ये 5 स्टेप है. इंजेशन मीन्स खाना अंदर लेना, डाइजेशन मीन्स फूड का डाइजेस्ट हो जाना, एब्जॉर्प्शन मीन्स बॉडी ने एब्जॉर्ब कर लिया, Assimilation means whatever is absorbed by the body gets assimilated, becomes a part of the body. Assimilation हो गया. And excretion means जो unwanted है उसको body से बाहर निकाल. तो जो body से बाहर निकलेगा वो क्या सबका निकलेगा? Yes, सभी का निकलेगा. तो सबको पता होना चाहिए कि कितना quantity is ideal quantity, कितना होना चाहिए. क्योंकि when we talk about, जब हम फॉर्म फिलअप करते हैं ना, ये हम सब बातें पूछते हैं. पानी कितना पीते हैं, स्टूल रोज पास करते हैं कि नहीं, कॉन्स्टिपेशन है क्या, टेस्ट में क्या पसंद है, बट वी डोंट नो व्हाट इज द नॉर्मल ऑफ इट. नॉर्मल किसको बोलते हैं? किसको नॉर्मल बोलते हैं? अगर मैं बोलूं कि 100 ग्राम ऑफ स्टूल इज नॉर्मल, 150 ग्राम ऑफ स्टूल इज नॉर्मल, दैट इज नॉट करेक्ट. क्यों करेक्ट नहीं है? इट वेरीज विद पर्सन टू पर्सन. व्हाई पर्सन टू पर्सन? बिकॉज एक 5 साल के बच्चे का और एक 50 साल के पर्सन का स्टूल का अमाउंट सेम होगा? नहीं होगा. कोई कम खाता है, कोई ज्यादा खाता है, उसका क्या सेम होगा? नहीं होगा. सो स्टूल should be measured according to quantity of food a person takes. Yes, intake is different for all. So we say that 600 ml of chyme forms 200 gram stool. Simple. इसका मतलब क्या है? Chyme मतलब what is chyme? The slurry that is formed in the stomach and goes into the small intestine for further digestion and absorption is called chyme. Simple language में क्या बोलेंगे? जितना खाना खाया जब वो पेस्ट फॉर्म में बन गया, स्टमक और इंटेस्टाइन में जाके जब पेस्ट बन गया, तो पेस्ट कैसा होगा? ड्राई होगा क्या? नहीं. It is semi-solid in nature. Why semi-solid? Because it has to pass through small intestine. So ये जो काइम है, ये जो स्लरी है which is formed in the stomach, अगर ये 600 ml है तो उसमें से 200 ग्राम स्टूल बनेगा. Now you can understand almost 1/3 of whatever we eat, almost, I said almost, forms a stool according to weight of the food that we take in. Okay? But this is one thing, this quantity is one thing that is not measured by stool test. When we talk about pathological reports, it does not give you the understanding of कि आपका stool कितना है, कितना form हो रहा है every day. Why? Because it is, when we give the stool test, stool for stool test, it is only the quality, not the quantity. Second important point out of 5 points is odor. Odor means the smell of stool, जिसके लिए stool is defamed, है ना? Why that odor is there? Odor of the stool is there because of 2 substances. 2 चीजें हैं जो उसे बदनाम करती हैं. एक है जिसको बोलते हैं इंडोल और एक है जिसको बोलते हैं स्केटोल. अब ये इंडोल और स्केटोल क्या है? Indole and scatol are 2 substances which are formed by decomposition of amino acid. Amino acid क्या है? The smallest form of protein. प्रोटीन का जो सबसे सिंपल भाग है ना, और वो भी कौन सा? इसको हम बोलते हैं ट्रिप्टोफैन. ट्रिप्टोफैन. ट्रिप्टोफैन अमाइनो एसिड के डीकम्पोजिशन से 2 सब्सटेंस बन जाते हैं बॉडी के अंदर. कौन से? इंडोल एंड स्केटोल. और यही 2 सब्सटेंसेस हैं जिसके कारण एक स्मेल पैदा होती है. जबकि इफ यू रीड मोर अबाउट इंडोल एंड स्केटोल, देन यू विल अंडरस्टैंड डिफरेंट प्रोपोर्शन ऑफ इट इज ऑल्सो रिस्पॉन्सिबल फॉर फ्रेग्रेंसेस ऑफ डिफरेंट फ्लावर्स. गुड फ्रेग्रेंस के लिए भी जिम्मेदार है, बट हम उसकी बात नहीं करें. अभी बात करें some ऐसे स्मेल के लिए which is not needed by the human nature. Okay, so indole and scatol are 2 substances which are formed by decomposition of tryptophan amino acid, that is protein, and it gives a bad smell. That means those who will eat, odor किसकी ज्यादा होगी? अगर प्रोटीन का ही सब्सटेंस है जिसके कारण स्मेल हो रही है, तो जो प्रोटीन इंटेक ज्यादा करेंगे, if the protein intake is more, then the odor will be more. Why? Because it is the decomposition of protein that is giving the odor. That means those who takes non-vegetarian food. That means those who take a lot of protein, animal protein, meat, in that condition again the odor would be more. Also, it's a very important point of diagnosis also, that those who have pancreatic disorders, will also have more odor. Why? Pancreatic disorder का मतलब ही क्या है? Pancreas का काम क्या था? The importance of pancreas was to digest protein, mainly protein. Why? Through pancreatic juice. So अगर pancreatic juice ठीक से नहीं निकला, अगर pancreas ने अपना काम ठीक से नहीं किया, then protein would be not treated properly in the body. That means a lot of protein will stay like that in the body. It will decompose more, just like that. Or फिर odor will be more. Okay. So these are some of the conditions in which there will be more odor in the stool. So अगर odor ज़्यादा हो रही है, तो क्या समझना है? कि protein is getting decomposed. We need to understand how much protein are we taking. देखो, due to sweets, अब स्वीट में आप देखो स्वीट कौन से टाइप का, मिल्क प्रोडक्ट है क्या ज्यादा? मिल्क प्रोडक्ट अगर बहुत ज्यादा है तो क्या होगा? ओडर विल बी मोर, है ना? मैंने आपको बेस दे दिया, अब आप मुझे कैटेगराइज मत करना कि स्वीट्स खाया या हमने फ्रूट्स खाए. आप देखो किसमें प्रोटीन ज्यादा है. जिसमें प्रोटीन ज्यादा होगा दैट विल गिव दिस टाइप ऑफ कंडीशन, मोर ओडर. थर्ड थिंग दैट वी नीड टू अंडरस्टैंड इज color. So what about color of the stool? One is, what is the first we should understand, what is the ideal color, the normal color of stool? It should be golden brown. It's not golden yellow, it is golden brown. And I'll tell you the reason also. Why stool is of this color? Golden का मतलब भी उसमें yellowish color आ गया. This is very interesting. At the end, I'll tell you this reason. I'll not go into that right now. But we need to understand, if it is, just note it down, because Professor G.C. Agarwal ji has given this is in a very beautiful and compiled way, that if it is golden yellow, then understand that the person takes a lot of milk. If it is dark brown, it is because of non-vegetarian food. If it is greenish in color, then understand that it is because of intestinal disorders. Why intestinal disorders? Because it is actually the bile that is coming out. Bile is greenish in color, greenish yellow in color. If it is clay colored, clay colored means whitish. It has mix of white in it. It says that it is obstructive jaundice. Again, the same thing. So in case of obstructive jaundice, the pigment that should have come out in the stool is not coming out. We'll come to that when we'll discuss this color, why stool is yellowish brown in color. Okay, so clay colored is obstructive jaundice. Pale yellow, that means slightly yellowish in color, is because of a condition called steatorrhea. Steatorrhea, RRHOEA, steatorrhea. What is steatorrhea? Steatorrhea is a condition when fat is coming out of the stool in undigested form. So when the fat comes out in the stool, the condition is called steatorrhea, and the color of the stool would be pale yellow in color. Okay. Why the fat will come out in the stool? Fat will come out in the stool if fat is not digested properly. Why fat is not digested properly? What digests the fat? What helps in? I gave you one term in last session, and I asked you to remember that term. It is not digestion of fat. It is emulsification of fat. So remember this word, emulsification. Emulsification means breakdown of fat into simpler substances. तो कौन नहीं कर पा रहा है? लीवर नहीं कर पा रहा है, गॉल ब्लैडर नहीं कर पा रहा है. सो अगर लीवर गॉल ब्लैडर की प्रॉब्लम है तो फैट जिस कंडीशन में खाया उसी कंडीशन में शरीर से बाहर आ गया. So it is not only the color but also the texture of the stool will change if the fat is coming out. It becomes more frothy, झागदार हो जाता है. ठीक है. So steatorrhea, in case of steatorrhea, it is a fat. Culprit is fat. Dark, tarry, tar like. टार पता है वो जो रस्से बनाने में यूज होता है. हाँ, ब्लैक, स्टिकी. डार्क और टार लाइक क्यों होगा? इफ देर इज ब्लीडिंग इनसाइड. ब्लीडिंग. बट ये ब्लीडिंग कहाँ हो रही है? समवेयर इनसाइड. इफ इट इज इनसाइड देन व्हाट विल हैपन? Till the time it comes out of the body, this blood is coming out of the body, it has already traveled some area, है ना? For example, अगर stomach में हो गई bleeding, ulcers वहां पे bleeding हो गई. So what will happen to the blood that comes out? It has to travel first the small intestine, then it has to travel the large intestine, then it is getting collected in rectum. By the time blood oxidizes, क्या हो गया? Blood oxidize होके क्या हो गया? Black हो गया. ठीक है. सो स्टूल का कलर क्या हो जाएगा? डार्क इन कलर. सो अगर देखो 2-3 कंडीशंस हैं. ब्लड किस फॉर्म में बाहर निकल रहा है? ईदर इट इज फॉर्मिंग द नेचर ऑफ द कलर ऑफ द स्टूल इज चेंजिंग टू डार्क, देन इट सेज दैट ब्लीडिंग इज समवेयर इनसाइड. इफ इट इज रेड, फ्रेश ब्लड इज कोटिंग द स्टूल है. चलो नेक्स्ट ही ले लेते हैं, जैसे ब्राउनिश रेड stool. This is stool. And if there is a coat on the stool, this is coat. If this coat is there, then it is saying that there is some bleeding somewhere in the large intestine or nearby area. And that is why it is not getting chance to get oxidized. Before oxidation, it is coming out of the body. बात समझिए स्टूल टेस्ट कितना इंपॉर्टेंट है. स्टूल, व्हाई स्टूल टेस्ट? आप स्टूल टेस्ट को भूल जाओ. जो मैं अभी बात बोली ना, ये मैं बहुत बार बोली हूँ और मैं आज फिर से बोली हूँ. स्टूल टेस्ट को भूल जाओ, क्योंकि जैसे टेस्ट की बात आती है ना, हमारा दिमाग कहाँ जाता है? लैब रिपोर्ट्स में जाता है. What we have to focus on is observe your stool every day. अब देखो यहाँ कितने लोग ऑब्जर्व करते हैं. बिफोर यू फ्लश आउट योर स्टूल, बहुत लोग मुझसे पूछते हैं मैम क्या खाना चाहिए, क्या नहीं खाना चाहिए, प्लीज मुझे एक बना के दे दीजिए. व्हाट इज गुड फॉर अस, व्हाट इज नॉट गुड फॉर अस. बहुत लोग न्यूट्रिशनिस्ट के पास जाते हैं, कितने कितने पैसे खर्च करते हैं, क्या खाएं क्या नहीं खाएं. कोई बोले इतना खाओ, कोई बोले इतना खाओ, कोई बोले ये खाओ, कोई बोले ये मत खाओ. ऑब्जर्व योर स्टूल. दिस इज वेरी इंपॉर्टेंट. अगर आज आपने इतनी सी भी बात समझ ली ना, तो मेरा ये 1 घंटा और आपका ये 1 घंटा सफल हो जाएगा. इफ यू वांट टू अंडरस्टैंड व्हाट इज गुड फॉर यू एंड व्हाट इज नॉट गुड फॉर यू, ऑब्जर्व योर स्टूल एवरी डे बिफोर यू फ्लश इट. व्हाई? अगर स्टूल प्रॉपरली फॉर्म्ड है, आपको उसके अंदर कोई अनडाइजेस्टेड फूड पार्टिकल नहीं दिखाई दे रहे, तो ये बता रहा है कि जो आपने लास्ट खाया या प्रीवियस डे जो खाया, that is properly digested. If it is showing something which is irregular means आपको लग रहा है कुछ गड़बड़ निकला है ना, इसमें छी का कोई बात नहीं है, ये करना है, ये इंपॉर्टेंट है, किसी के सामने थोड़ी ना करना है, ये तो आपके और स्टूल के बीच की बात है। अगर उसके अंदर कुछ ऐसा निकला विच यू फील इज नॉट नेचुरल, फॉर एग्जाम्पल भुट्टे के दाने निकल गए, तो भुट्टे के दाने क्या बता रहे हैं? क्या आपका सिस्टम उसको डाइजेस्ट नहीं कर पाया? नहीं, वो क्या बता रहा है? टेक योर लेसन, योर लेसन इज दैट यू डिड नॉट च्यू इट प्रॉपरली। क्यों? क्योंकि स्टमक में जाने से पहले आपके भुट्टे के दाने को चबाना था आपको, दैट मीन्स यू आर ईटिंग टू फास्ट। हाँ, आप बोलो लेडी फिंगर सीड्स ऑलवेज कम्स आउट, ये बहुत लोगों के संग होता है। अब लेडीज फिंगर का, खाली लेडी फिंगर क्यों, बहुत सारे ऐसे सीड्स हैं जो यूं के यूं निकल जाते हैं। क्यों निकल जाते हैं? बिकॉज सीड्स ऑलवेज हैव अ वेरी स्ट्रॉन्ग कोटिंग ऑन इट, ये प्रोटेक्शन की कोटिंग होती है सीड्स के ऊपर, अलग कहानी है, टू प्रोटेक्ट इट फ्रॉम नेचर। तो उस कोटिंग, उस डिफरेंट सॉल्ट्स की जो कोटिंग होती है, सॉल्ट मीन्स यहाँ पे कैल्शियम के डिफरेंट सॉल्ट्स, मैग्नीशियम के डिफरेंट सॉल्ट्स, है ना। हाँ, वॉट एवर सीड इट इज, वी आर नॉट टॉकिंग अबाउट इंडिविजुअल सीड, वॉट एवर सीड, फॉर एग्जाम्पल इफ इट इज कमिंग आउट ऑफ द बॉडी, दो चीजें बता रहा है, एक नॉट च्यूड प्रॉपरली, सेकेंड डाइजेशन इज वीक। भगवान से अगर मांगना है ना, तो जब हम गुड हेल्थ मांगते हैं तो ऐसा भी मांगे, अगर सब कुछ खाना है तो मांगे कि सब कुछ को हजम करने की भी ताकत हो, है ना। आप रास्ते पे रहने वाले जो बच्चे और जो लोग होते हैं ना, उनको देखोगे सारा दिन उनका तो अनहाइजीनिक कंडीशंस, एंड ऑल्सो दे ईट एनीथिंग दे गेट, स्टिल दे सर्वाइव। क्यों? इतना स्ट्रॉन्ग इम्यूनिटी मिल गई है नेचर से, सर्वाइवल ऑफ द फिटेस्ट। और जिनकी बड़ी सेंसिटिव डाइजेशन होता है, वो अच्छे से अच्छा खाना खाएंगे ना, वो भी स्टूल में निकल गया। आप सीड्स की बात कर रहे हो, सीड्स यहाँ पे नट्स निकल जाते हैं, बोलते हैं हम तो मैम रोज खाते हैं, आलमंड्स खाते हैं, हम तो वॉलनट खाते हैं, अंजीर खाते हैं, फिर भी शरीर में कुछ नहीं लगता है। हु इज द कल्प्रिट? इट्स अ डाइजेशन। So if the digestion is not good, it will come out in the stool. Then who will tell you that your digestion is not good? Stool. So you have to observe your stool every day. Now you will ask me, ma'am, what to observe? आपने क्या देखना है? आपको देखना है कि whether it is properly formed or not. पहला क्या था? क्वांटिटी था ना, तो आपको खुद को भी समझ में आ रहा होगा कि कितनी क्वांटिटी होनी चाहिए। इफ इट इज लेस इन अमाउंट, आप समझ लो कुछ अमाउंट अंदर रह गया, इसका मतलब ये नहीं है कि अंदर कम बना। बहुत लोग ऐसा सोचते हैं हमने तो कम ही खाया था। इतनी लंबी गट है, स्मॉल इंटेस्टाइन इज ऑलमोस्ट 16 फीट, 16 feet is almost on an average the length of a room, नॉर्मल एक एवरेज रूम की लेंथ बोले तो इतनी लंबी गट के अंदर से उस फूड को क्रॉस करना था। दैट मीन्स फॉर श्योर देर इज सम अनडाइजेस्टेड और नॉट फॉर्म्ड प्रॉपरली फूड इन द गट, और मे बी सम फॉर्म्ड स्टूल इन द लार्ज इंटेस्टाइन। क्लियर ही नहीं हुआ। That is why along with whatever treatment we give to the patient, we also prescribe isabgol and tripla to the patients very frequently. जो चेंबर आते हैं उनको पता है क्यों, क्योंकि स्टूल बहुत बड़ी बीमारी है अगर इफ इट इज नॉट फॉर्म्ड प्रॉपरली और इफ इट इज नॉट एक्सक्रीटेड आउट प्रॉपरली। यू हैव टू टेक क्लेंजिंग एलिमेंट्स टू क्लीन योर गट। जैसे हार्पिक डाल के आप टॉयलेट को क्लीन करते हैं ना, वैसे ही कुछ डाल के उसको क्लीन करना चाहिए। रफेज, योर बॉडी नीड्स सम रफेज to push out the excretory material. Okay, so one is consistency, whether it is amount, whether it is sufficient. Second is the fragrance, odor. बहुत ज्यादा स्मेल हुआ तो आप देखो क्या खाया था, so it is excreted out. Third is the color. You have to see the color of the stool. एक बार ऐसा ही हुआ मेरी, when my daughter was very small, almost 2 years, 2.5 years, she passed out stool and that was absolutely blue. I was so surprised and shocked. ये ब्लू कलर का स्टूल, अब मैं क्या इनसे इन्फरेंस निकालूं कि ब्लू कलर का स्टूल कैसे आ गया। Then I recalled back, क्या खाया था, कुछ याद ही नहीं आ रहा. Then I suddenly remembered yesterday she went to a birthday party. और बच्चों को खाली शुगर कोटिंग को पसंद आती है केक की. And the cake was blue. Yes. So it is telling you what you had will come out in the stool. है ना? So अपने stool का color will guide you कि ये ठीक खाया था या नहीं खाया था. Seeds coming out, I told you, seeds, if it is coming out of the body, two things. You did not chew it properly. Your digestion could not digest it properly. Digestive juices are weak. HCl is a very strong acid, mild acid नहीं है. It is considered as one of the strongest acid. So it should digest everything that comes to it. Okay. Fourth point is consistency. Consistency means कैसा है, उसका texture कैसा है. For example, first let us understand what is a normal consistency of stool. It is called pultaceous. Pultaceous means soft. Stool should be soft. It is the normal. Use the right term. Okay. So every time we learn something new. So this is a new term, pultaceous. That is the consistency of stool. But if it is semi-fluid, semi-fluid says that there is a condition of diarrhea or diarrhea-like. Spelling should be correct. D-I-A-R-R-H-O. Don't miss out O. Diarrhea. If it is hard, it is constipation. After hard, write down one word. This is called Cybala. S-C-Y-B-A-L-A. साइबला. साइबला मतलब होता है जैसे खेमका सर ने बहुत जगह अपनी किताबों में रखा है, जैसे लिखा है जैसे बकरी की मिंगनी के जैसा गुठलियां बन जाए. हाँ, स्टूल की छोटी छोटी गुठलियां बन के निकल रही हैं. दैट इज कॉल्ड साइबला. साइबला इज डिहाइड्रेशन along with constipation. Slimy. Slimy means there's a lot of mucus. So this mucus is not good because mucus should line the canal. It should not come out with the stool. Watery. If it is watery, it may be cholera. Cholera is a bacterial disease. Usually गंदे पानी और गंदे भोजन से होती है cholera. So stool would be watery, or it may be pus containing. Example in dysentery. And frothy. Frothy means, again as I told you, जब मैंने आपको कलर बताया था, तो फ्रॉदी अगर होगी तो ये कौन सी कंडीशन है? स्टेटोरिया. दैट मीन्स फैट इज कमिंग आउट. फैट अगर आएगा ना तो झागदार बना देगा स्टूल को. So this is the fourth point. We said that there are 5 points that we should understand. First one was amount, कितनी क्वांटिटी में निकल के आ रहा है. Second is odor. Third is color. Fourth is consistency, किस consistency का है. And fifth one is some abnormal conditions. some abnormal conditions. Abnormal conditions कैसे हो सकती हैं? For example, discoloration. Discoloration का मतलब पता है क्या है? Discoloration means जैसा कलर होना चाहिए वैसा नहीं है. What is the ideal color? Golden brown. So अगर golden brown नहीं है तो discoloration है ना? इसमें एक चीज आप लिख के रख लो, and I'll tell you more about it. This is very important, that it is the pigment that is responsible for the color of the stool is called stercobilin. If stercobilin is not there in the stool, it will be discolored, because that is the most common reason for discoloration. Okay, stercobilin, जैसे ओडर के लिए हमने दो सब्सटेंसेस का नाम याद किया, वैसे ही हम कलर के लिए भी याद करेंगे. देखो कुछ कुछ वर्ड्स हैं जो आज हमने सीखे. फॉर एग्जाम्पल कलर के लिए कौन रिस्पॉन्सिबल है, फॉर एग्जाम्पल ओडर के लिए कौन रिस्पॉन्सिबल है, फॉर एग्जाम्पल कॉन्स्टिट्यूएंट उसका कंसिस्टेंसी कैसी होनी चाहिए, पल्टेशियस. ये दीज आर सम स्पेसिफिक वर्ड्स that are used for stool. Okay, mucus. If mucus is coming out of the stool, it says infection. See, body has an immune system. Body has a homeostasis mechanism. So whenever there is some infection, for example, if there is any cut, if there is any cut somewhere, so body क्या करती है, तुरंत वहां पे एक clot बनाती है. So blood clot is good for the body or not good for the body? Depends where it is and when is it formed, right? So for balancing the body's system, blood clot is formed if there is any cut, if there is any burn somewhere, कहीं जल गया. So for burn there will be accumulation of water, blister हो गया वहां पे, है ना. burn के बाद क्या होता है, water blister बन जाता है ना वहां पे. So that water blister is good or not good? It is good, because it is forming a cushion on the burnt area so that there is no external injury and the area starts healing faster. Okay. Similarly, if there is mucus, more mucus somewhere, it is telling you that there is infection. To throw out the infection out of the body, to throw out that infectious particle, body will build up something with which the pathogenic particle will come out. Okay. So more mucus is guiding you, it is telling you. I'm not saying mucus is good, so let it be inside the with the stool. No, you understand, seeing the mucus along with the stool, that if mucus is formed more, that means there is infection. That mucus itself is guiding you. So it says that there is infection. If there is blood, this we have already done, but if there is blood, this blood may be occult blood, OCCULT. Very frequently it is mentioned in the stool test reports that occult blood is present or occult blood is absent, whatever it is. Occult blood if present in the stool. What is the meaning of occult? Occult means hidden. That means you will not be able to see blood with naked eyes. But when the stool test is done in laboratory, it is found that it has some blood particles, blood cells are there. So that blood is what? Hidden blood. So what does it guide you? That there is some bleeding inside. Yes, there is some bleeding inside. Where is that bleeding? It may be somewhere near the stomach area. Why is near the stomach area? Because if the bleeding is deep inside in the gut, then it gets mixed up with the food, with the chyme and in the feces. And when it comes out, it will not be visible with the naked eyes. So that is occult blood. Or it may be fresh blood. So this fresh blood says that there is some bleeding near the lower part of the intestine. That means usually near the LI, large intestine. Maybe ulcer, maybe some injury, any reason may be there. or maybe drops of blood. Drops of blood is there. Why drop of blood would be there? If it is drop of blood along with stool, you passed out stool, and after passing the stool or during the stool is thrown out of the body, there is drop of blood which is falling. This drop of blood is saying there are hemorrhoids. Hemorrhoids, that is piles or some other unwanted growth near the anal canal. Okay, near the opening. Anything may be there, and some wound may be there, fistula or whatever it is. Several reasons may be there. That means physical examination is very important if there is bleeding while passing stool. Okay. Next is fat. If there is fat that is coming out of the body, it is saying get your liver checked. That means fat is not emulsified by the bile produced by the liver. So it is coming out. That is abnormal condition. There may be protein. Protein is called the building material of the body. Okay, building bricks. Protein makes up the body. If there is any injury and it heals up fast, that says that you have taken sufficient protein. But if this protein is coming out of the body, that means body is throwing it out of the body as unwanted substance. Is that good? No, that is not good. That means this protein is not used by the body to build up the body. बॉडी ने उसको यूज ही नहीं किया बनाने के लिए. प्रोटीन तो हमारी बिल्डिंग मटेरियल था ना. तो प्रोटीन अगर शरीर के बाहर आ रहा है, हाउ विल इट कम आउट? इन द फॉर्म ऑफ फाइबर्स. दिखेगा नहीं आपको, स्टूल को देख के नहीं पता चलेगा कि वहां पे प्रोटीन आ रहा है. दिस इज ओनली थ्रू लैब टेस्ट. If protein is coming out of the body, there will be a lot of weakness. Why? Because it is a building material. There may be pus. एक वर्ड और सीखेंगे. ओडर के लिए सीखा हमने, कलर के लिए सीखा, कंसिस्टेंसी के लिए सीखा. अब हम पस से रिलेटेड एक और नया वर्ड सीखेंगे. विल लर्न वन मोर न्यू वर्ड दैट इज कॉल्ड प्यूरुलेंट. PURULENT. प्यूरुलेंट एक्सुडेट. प्यूरुलेंट का मतलब ये पस. Exudate means that comes out. Purulent exudate. So if pus is coming out in the stool, you can use good words while writing your prescription. There is purulent exudate in the stool. Okay, so this is something that we will learn. Write down all the new words together in one page and revise it 2-3 days. You'll remember it in future. Pus is good or not good? Definitely not good. Why? Because it is telling you that there is infection. And last is some microorganisms. These microorganisms may be protozoa. These may be bacteria. These may be some eggs of some infectious pathogens. Different type of protozoans are there. We are not going into the detail, but protozoans may be present in the stool. It is, and it is not necessary that it has to be there. It may be present. It is again saying that these are unwanted. Bacteria, some bacteria are good. Some bacteria are bad. How many bacteria are present in the gut? I'm not talking about large intestine. In the whole gut, it is said that about 100 trillion. पता करना ट्रिलियन कितना होता है? 100 trillion bacteria are present in the whole gut and in the and different parts of the body. Skin, nostrils, mouth, large intestine, your urinogenital area. Out of that, maximum amount of bacteria are present only in large intestine. I'm not talking about good or bad. I'm talking in general. Maximum amount. कितना पता है large intestine में कितने बैक्टीरिया? More than the number of people who are staying on the earth. ये मैं सबके मिला के नहीं बोल रही हूँ, 1 person का बोल रही हूँ. एक आदमी की लार्ज इंटेस्टाइन में अर्थ पे रहने वाले जितने लोग हैं उनसे ज्यादा बैक्टीरिया प्रेजेंट है. More than 1000 species are there in the gut, in the large intestine, out of which some are good. These good bacteria are needed by the body. For example, E. coli, Escherichia coli. These bacteria help in production of certain vitamins. For example, vitamin K. Okay. इसीलिए gut की health includes gut flora. Okay. Gut के अंदर ये organisms रहने चाहिए. These are something which take help from the body and give something in return. Those are bacteria. Eggs. Stool में अगर egg होंगे तो these eggs are telling you that there is infection in the gut. ये बड़ा dangerous चीज है egg. आज से मुझे जब भी whenever I talk about egg, I remember Sir J.P. Agarwal ji talking about these structures which keep on flowing in the blood. आज से 15-20 साल पहले की बात कर रही हूँ. I started in 2002. उस समय से सुनती आ रही हूँ, सर हमेशा कहते हैं कि जब भी ये कीड़े पेट में होते हैं ना, तो इनके एग्स कभी भी खत्म नहीं होते. These eggs keep on flowing in the blood circulation. और इम्यूनिटी देखिए किसकी किसकी. आई एम नॉट टॉकिंग अबाउट ह्यूमन बीइंग, आई एम टॉकिंग अबाउट ये कीड़ों की. फॉर एग्जाम्पल टेप वॉर्म, कभी टाइम मिले ना लिख के रख लो, पढ़ना है बाद में फ्यूचर में. ये टेप वॉर्म होते हैं ना, कुछ ऐसे होते हैं, बड़े गंदे से देखने में होते हैं. सो दीज टेप वॉर्म्स आर, इसमें हुक होते हैं यहाँ पे. ये हुक से आपके इंटेस्टाइन को ऐसे पकड़ के रखते हैं और यहाँ से सक करते हैं. और इसका एक एक सेगमेंट जो है ना, जैसे वो रक्त बीज था ना, ये रक्त बीज जो था वो राक्षस था ना, एक बूंद गिरती थी और वैसा ही एक राक्षस पैदा हो जाता था. ये एक एक सेगमेंट के अंदर में एबिलिटी टू रीजनरेट. सो when something is coming out in the stool and it says कि वॉर्म निकल गया, वो वॉर्म नहीं है, ओनली अ पार्ट ऑफ इट. वो धोखा देते हैं, कुछ पार्ट उसका निकाल देते हैं, बाकी का लगा हुआ है अंदर में. और एक एक पार्ट के अंदर अंदर जब ये एक एक सेगमेंट, इफ इट रप्चर्स, इट gives out several eggs and each egg has the ability to regenerate. ठीक है. सो एग्स क्या चीज के हो सकते हैं? एग्स बहुत टाइप के हो सकते हैं. बहुत सारे वॉर्म्स हैं जो हमारे गट में हो सकते हैं. फॉर एग्जाम्पल टेप वॉर्म, राउंड वॉर्म, हुक वॉर्म, लैश वॉर्म, बहुत तरीके के वॉर्म्स हैं. उसको निकाल के इंटरनेट से पढ़ना कितने टाइप के वॉर्म्स हो सकते हैं. एंड दैट इज व्हाई I always, as I always say, gut cleaning is very important. इनेमा जिसको बोलते हैं ना, नेचुरोपैथी का बड़ा इंपॉर्टेंट पार्ट है इनेमा. सो आप नेचुरोपैथी करते हैं तो एवरीडे के रेगुलर फूड हैबिट में कुछ ऐड करना है तो त्रिफला लीजिए, ये सब गोल लीजिए. एक्यूप्रेशर से यूज करना है, टीसीएम से यूज करना है तो LISIST का होमोहेट्रो लगाइए. और अगर आयुर्वेदिक एक्यूप्रेशर यूज करना है देन यूज LISIST, जीरो टोन 908. वेरी इंपॉर्टेंट and wonderful results because these are the points for infection of the body. So now I'll come to the last part. I said LISIST, either zero tone 908, कहाँ करना है, कैसे करना है, ये अब थोड़ा सा किताबें खोलेंगे, या LISIST होमोहेट्रो, या जिसको हम बोलते हैं डार्कनेस लाइटनेस points. So these are not only the points for disinfection but also very good points for डिवॉर्मिंग। यहाँ तक कि फीवर में भी हम इसको बड़ा इंपॉर्टेंस देते हैं, बिकॉज फीवर इज ऑल्सो रिलेटेड टू गट हेल्थ। द लास्ट पार्ट, फॉर द लास्ट पार्ट एक काम करते हैं, इसको झट से समझ लो, बिकॉज दिस इज समथिंग दैट विल ऑलवेज हेल्प यू। सी, दिस इज ह्यूमन बॉडी। आप बोलो कि ये ह्यूमन बॉडी है, यस दिस इज ह्यूमन बॉडी, क्योंकि बिकॉज हमारा फोकस अभी एब्डोमेन पर है। दिस इज ये कुछ ऐसे है, एंड लेट अस टेक one as this is stomach, this is spleen, and this is liver। ठीक है, इसको बस समझ लो, कहीं लिखना चाहते हो लिख लो, बिकॉज यू मे नॉट बी एबल टू रिमेम्बर everything that I mentioned, so just note it down. When the blood, this is what, this is your, let us label it, this is your stomach, this is spleen, this is liver, okay? So red blood cells has a lifespan of 120 days. So after 120 days, when the cells are coming to spleen, red blood cells break down. कौन ब्रेक डाउन करते हैं, हम बहुत डिटेल में नहीं जा रहे हैं, क्योंकि बहुत ज्यादा नहीं समझना है, बस इतना समझना है कि हमारे स्टूल टेस्ट से रिलेटेड हो। So RE सिस्टम होता है, रेटिकुलो एंडोथेलियल सिस्टम, दैट ब्रेक्स डाउन आरबीसी इनटू इट्स कंपोनेंट्स। वन ऑफ द कंपोनेंट इज हीमोग्लोबिन, ये पता है ना। आरबीसी टूटेगा तो क्या निकलेगा, हीमोग्लोबिन निकलेगा। Now there are some bacteria that are working on hemoglobin, and it breaks down into heme plus globin. Heme क्या है, iron, globin क्या है, protein. When this heme comes out of hemoglobin, there are again some reactions. There are two reactions that are happening, and it converts this heme into biliverdin first, and then bilirubin. हीमोग्लोबिन किसमें कन्वर्ट हो गया, पहले हीम और ग्लोबिन में। हीम किसमें कन्वर्ट हुआ, बिलीवर्डिन में। बिलीवर्डिन किसमें कन्वर्ट हुआ, बिलीरुबिन में। ये पिगमेंट्स है। बिलीरुबिन कैसा पिगमेंट है, एक येलोइश टाइप का पिगमेंट है, ठीक है। अब ये बिलीरुबिन है ना, दोस्ती नहीं करता है किसी से, बड़ा अकेला चुपचाप बैठा हुआ पिगमेंट है। इसको जाना कहाँ था, इसको जाना था लिवर में। कहाँ जाना है बिलीरुबिन को, लिवर में। बट बड़ा इंट्रोवर्ट है, नहीं जा सकता, तो कौन हेल्प करता है इसको, एल्ब्यूमिन हेल्प करता है, और बोलता है चलो मैं तुमको लेके चलता हूँ लिवर में। सो एल्ब्यूमिन इज अ प्रोटीन दैट टेक्स दिस बिलीरुबिन टू लिवर। व्हाई बिलीरुबिन इज टेकन टू लिवर, बिकॉज इट इज अ वेरी इंपॉर्टेंट कंपोनेंट ऑफ बाइल, ठीक है। अब जब ये बिलीरुबिन आ गया लिवर में, देन अगेन इट्स फॉर्म चेंजेस, और ये बड़ा एक्सट्रोवर्ट बन जाता है। पहले कैसा है, इंट्रोवर्ट, किसी के संग नहीं मिलेगा, किसी के संग नहीं, यानी ब्लड के संग भी नहीं मिलता है, ब्लड से भी दूरी बना के रखा है, ब्लड में मिक्स नहीं होगा। बट व्हेन इट कम्स टू लिवर, नेचर चेंज हो जाता है, इट बिकम्स फ्रेंडली, इट बिकम्स मिसेबल, दैट मीन्स मिक्सेस विद द ब्लड, दैट इज कॉल्ड कॉन्जुगेटेड bilirubin. Now this bilirubin, which is in different form, it comes out of the liver through bile. किससे निकला, बाइल से निकला। And when something comes out from the liver, it comes out into स्टमक से क्या है, यहाँ से हमारे पास स्मॉल इंटेस्टाइन. So this is small intestine. This whole area is small intestine. Let us use another color. This is small intestine. So when bilirubin is coming out through bile, it gets converted into another form that is called urobilinogen. Just write it down like that only. Urobilinogen. किसमें convert हो गया bilirubin? Urobilinogen. Or urobilinogen in the intestine only gets converted into another form which is called S-T-E-R, stercobilinogen. This stercobilinogen gets converted into stercobilin. ये कहाँ हो रहा है? ये सब गट में, इंटेस्टाइन. This stercobilin is the pigment that makes the feces golden brown. Now, body is very interesting. A part of this urobilinogen only goes to kidney. It is going to kidney. And in the kidney, this urobilinogen gets converted into urobilin. This urobilin is the pigment that makes the urine yellow. Okay, I'll repeat it again very fast. First is the RBC that goes to spleen, breaks down into heme and globin. Heme breaks down into biliverdin. Biliverdin changes into bilirubin. Bilirubin comes to liver. From here, it comes out through bile into the gut, that is duodenum, where it changes into urobilinogen, changes into stercobilinogen, and lastly into stercobilin that gives the color of stool. It's golden brown color. Part of urobilinogen goes to kidney and forms urobilin that makes the urine yellow. Okay, so this is the reason why I'm telling you all this. This is not to teach you anatomy, physiology of the body. This is to tell you that it is not only LI, but also your spleen, stomach, gut, liver are responsible in forming healthy stool. So don't focus only on LI. Take a screenshot of this. I'll just stop sharing the screen now. So the motto of this whole class and the whole understanding is it is not only one particular organ, but the whole body that is involved in forming a healthy stool. Okay, so stool test is not only related to lab tests, but also physical examination that can be done at home. And everyone should observe the stool every day before we flush. Okay, so this is all about stool test. I hope it could be of some help to you, and go through it once, the whole of the recording. Maybe it will be shared on YouTube channel also. And new insight about stool. Thank you so much, everyone.